Hey everybody, this is Dr. Rob Lindsay with our Autoimmune Treatment Success Secret number 8, brain function. Now, brain function is extremely important in treating the thyroid, as I've mentioned previously in other secrets. Okay, this is critical for autoimmune disease treatment and anything that you may be suffering from. The brain controls every bodily function. It's as simple as that. And your pituitary, for example, drives thyroid function. Your pituitary releases TSH, and the part of your brain called the hypothalamus is what drives the pituitary. Our brain, remember, it needs two things to survive and thrive. It needs fuel and activation. Excuse me. Fuel is from glucose and oxygen, which is why we use exercise with oxygen therapy in our office. We've addressed glucose into the equation in another video, and we do that with your diet. Now let's address the importance of oxygen. See, as you age, your ability to utilize oxygen decreases by 1% per year each year after the age of 25. So if you're 50 years old, you've lost 25% of your ability to utilize oxygen in your body. This is called oxidative phosphorylation, which is a big fancy $3 term meaning you're not using oxygen as well as you did when you were younger. Again, this is why we utilize exercise with oxygen therapy, or EWOT, in our office. Secondly, the neurotransmitter serotonin plays a major role in thyroid function and in autoimmune disease. There's a place in your brain called the hypothalamus, and there's something called the periventricular nucleus. I know these are big fancy words, but it's critical that you know this is if you're suffering from symptoms, you need to know this stuff. Serotonin acts on the hypothalamic periventricular nucleus in the central nervous system, and what it will do is make you have low thyroxine stimulating hormone, or low TSH. Taking thyroid hormones for these problems is not going to do anything for you. It will make things worse, most likely, but don't get me wrong. I'm not saying to stop taking your medication. That's called practicing medicine without a license, and we don't do that. But you need to be aware of what is happening in your body. I'm saying be aware of what's happening, because once you start asking medical doctors why you're taking these medications, they're going to look at you like you're crazy, like you have a psychosomatic illness, which means to them it's all in your head. And the only thing you need is an antidepressant. The biggest influence on serotonin is blood sugar. That's why we addressed glucose in our autoimmune treatment success earlier. So if you're hypoglycemic, insulin resistant, or diabetic, it's vitally important that you maintain your blood sugar levels within an optimal range. And this is why it's important to eat healthy too. You can't skip meals. You need to quit eating junk food. Every time you eat junk food, you're literally eating away at your thyroid and other tissues of your body, and you're making your problem worse. By consuming poor, junk-filled diet, you will increase your symptoms, whether it's your thyroid or autoimmune diseases. You'll feel tired or sluggish, your inability to lose weight, you'll have cold hands and feet, you'll gain weight easily, you'll have difficult, infrequent bowel movements, okay? You'll be depressed, have a lack of motivation, you might have morning headaches that wear off later on the day. The outer third of your eyebrows, you may be losing those, okay? And your skin and scalp may be dry, and you may have mental sluggishness, you may be nervous, okay? You're emotional, and you have night sweats. You have all of these symptoms, and yet your labs are normal in the eyes of your medical doctor. Remember, these labs need to be within the optimal or functional range. So, again, we need oxygen, we need glucose as fuel for your brain, because your brain runs everything. No matter what your autoimmune organ is being attacked by, you need fuel. You need brain function. If this makes sense to you, then you need to call our office, 952-949-0676. Let's see if we can give you some help. Hope to see you on your next Success Secret. God bless you. Have a good day.